Hi, welcome to another podcast, if you will. I'm Dr. Reese, and I'm here with the amazing Dr. Deb Davies. I've known Deb for many, many years. And over symposium this past November, we were sitting together and talking about all the amazing work she is doing, supporting acupuncturists in their support of women who are pregnant, giving birth, and postpartum. She's gone all in on this. She created an amazing push mentorship program. And in this interview, she wants to share with you ways that you can support pregnant women. We don't have to be scared. We can build, she's going to give you ways to build your confidence in treating and working with your pregnant mamas, the ones that are going to birth, maybe even being there during the birthing process and postpartum, and maybe some more. We'll see where this takes us. But Deb, thank you so much for hopping on this Zoom call with me. Tell me, can we start a little bit about just your background, like how you even got into the birthing process? I know you're a doula and you did that work, and you're a doctor of Chinese medicine.
Right. Well, thank you so much, East, for having me on today. I'm so happy to be here and share my story and to really be able to help more people. That is my ultimate goal, help more women. So my story is a little sad. I had a stillborn baby, my first child. I was excited and got married while I was pregnant, and unfortunately she died when I was 40 weeks along, and I gave birth to a stillborn baby. So that event really rocked me to my core. It really made me rethink my whole life and what was important to me and what really mattered. And I wound up starting PCOM shortly after that and going to PCOM. So I have a really profound why I do what I do. And so I went through school at PCOM, and I did the master's and the doctorate there. And what I felt like I learned was there's a disconnect, and it's all about fertility, cycle regulation, but then it's like what not to do with pregnancy. And then there's 2 slides on postpartum and we're moving on. And I think this is such a paramount part of our life. It's so important for everyone. And so I really want to help acupuncturists fill this gap in their practice, in their understanding, in their knowledge, so that they can gain confidence in treating especially pregnant women. I find a lot of acupuncturists in San Diego actually refer their patients to me when they're pregnant because they're afraid of treating them. And I really don't want you to be afraid. I think women need us during this time. And there's something really magical about being able to take somebody from fertility through the pregnancy and birth and all the way through postpartum and back again to have number 2 and number 3 and so on. And so I think that what we do can really have a profound effect in people's lives. It's really simple, and I really want to take out the fear and, sprinkle you with confidence. And so that's what I'm here to do. So I want to give you 3 tips for acupuncturists in treating pregnancy to boost your confidence and to just feel a little bit better. And especially for those who haven't had a baby, because that seems to be a really big thing for the acupuncturists that I talk about. So the first tip I'm going to give you is about intention. And when you're working with pregnant women and pregnancy in general, you want to set the intention that you're not doing anything to jar that pregnancy. Your intention is hold the baby in. And so what I do every single time with every single patient is do 20. It's the first point that goes in with every patient every time, unless you're trying, it's the end of, and she's getting ready to have labor, have her baby. So I tell the patient that, and I say, you make sure you let me, you remind me if I ever forget. And so we're both setting the intention that, nothing we're doing, that this is safe, that women have been doing this acupuncture for thousands of years during pregnancy, during birth. And so I think that just taking the fear out, getting it out on the table, because so many people just fear that they're pregnant and something is going to go wrong. So step 1, hold the baby in. Step 2 is know your red flags. What are the red flags in pregnancy? A headache, especially with visual disturbances, bright red bleeding, high blood pressure. Those are the things you need to know. And you can take a blood pressure in the office and find out if it really is an issue. So knowing those helps you also know when to refer out. And the third thing would be is develop your resources. I have a professional referral list that I highly recommend every single acupuncturist do. And for me, the people that are on that list are midwives I love, birth centers that are fabulous, OBGYNs that are amazing, birth doulas, postpartum doulas, placenta encapsulator, um, pelvic floor physical therapists, psychologists, trauma lines, emergency lines, all sorts of things, so that you get asked for this over and over and over, and you'll do yourself a service and it will help your business. Go find those people. If this is your demographic and these are your people, you develop that list and you call or you meet with every one of them, and you know those people are referring right back to you. And so I think that that's really helpful. As you know, my goal would be to see acupuncture in every labor and delivery across America. That would be my dream. And, you know, I really want to teach people that it's safe to treat in pregnancy. You can even treat during labor. And there's so much we can do in birth. I also do CEUs, and I had created one for Net of Knowledge that's about to come out, or on LASA OMS if it's the US, on postpartum. And in there, I talk about 22 postpartum diseases. And I think that understanding and having a little more information. So I did all of my CEUs and I traveled and I chose who to study with after I graduated so that I could have this specialization. And so now it's really my honor to turn around and to teach the future generations more about this, so that acupuncturists can, you know, have that continuity of care, have that confidence in treating this demographic, and see patients through their life cycle, that whole reproductive life cycle. Those are patients for life. You get them through their birth. Those people love you. And I think there's just so much we can do. You know, you treat what you find. You kind of fake it till you make it with your confidence. And you just, oh, if they're kidney deficient, tonify their kidneys. They feel better. Amazing. TCM works. You know, once you know your diagnostics and you treat accordingly, it works. And so those would be my tips.
Oh my goodness. More tips. That was so generous and I love that. It's simple and it's about having that confidence. I just love that. Thank you for sharing that. And also giving other acupuncturists, the physicians of Chinese medicine, this kind of permission to feel comfortable going in there. I love the idea of the resources, knowing that you start with your intention that way, and that we can be such an important integral part to the entire process. Like we really focus a lot on fertility, then they're pregnant, let's keep them pregnant, and then let's be there and not only get them back to how they were before they got pregnant, what if we can get them even better than they ever were before, which of course we can with our medicine. I mean, it's powerful. You also acted as a doula for many years. Is that correct? Like you've been part of several births, been there during the whole process, helping
Yep.
women deliver, right?
Yes. So what I do, my job is more like mental, emotional versus touching, delivering kind of thing. So as a doula, I'm supporting both the partner and the mama in labor. We work together prenatally to help them prepare for the birth, to make a plan, and to not just make a plan for birth, but then to make a plan for postpartum, because that's when the real fun begins, because now you have a baby. So there's a lot of things. It's like you just don't know what you don't know. So there's so much I love to teach my patients. I love to teach acupuncturists. I just want to up level this whole medicine and this understanding, and really just make it easier. Like everyone just keep it simple. You know, it's not that complicated. I want to take the pin out of that, you know, tension and anxiety, and really share with the world how beneficial it is. Like, for example, placenta previa is a condition where the placenta will block the cervix. So it says automatic C-section in the United States. And over the course of my career, because I really keep a close eye on my patients going through fertility, pregnancy, postpartum, this comes up a lot. And I have 100% success rate treating placenta previa. So it's something I want to teach people. Like it's a non-issue. If they come into your spleen chi is sinking, bujang, like that's it. And I just, it's amazing. It's really amazing. So that's why a lot of times I feel like people overthink and just I want to share stories and keep it fun and just.
And so in your workshops, I know you have one coming up November 20th. You're going to be teaching an 8.5-hour CEU course at the
Yeah.
Eastern School of Acupuncture and Traditional Medicine. And then you have your 3-month amazing push mentorship program. In those two programs, do you teach people clinically how to treat placenta previa and assist with reversing that diagnosis?
I will talk about that in both my CEU class and in the mentorship program. So the CEU class is going to be, it's kind of funny. This is my first time teaching live in person on the East Coast. So one of my colleagues, Dr. Thomas Kuo, is having me go to Eastern School, and he asked that I teach on fertility, pregnancy, birth, and postpartum. It's just put a little of everything. So I'm teaching a little of all of that. And then I'm going to do some practical in person. I'm going to teach some of my top tips, moxa things. I do moxa sacral fan, navel cupping, some cool things that not a lot of people do. And it's really exciting to be in person. I'm also going to be teaching at the Yosong conference in March in Los Angeles. And then the mentorship will be online. So I am currently recruiting amazing acupuncturists that really want this expertise and education. And so far we have people from Hawaii to San Diego to Colorado and Philadelphia, Louisiana. It's exciting. So I want to help people become the expert in their community and help them.
I love that. So your mentorship, the Push Professionals Mentorship, that's an online program. It's 3 months. The first month is how to support pregnancy effectively. Second one is the birth process. And the third month is postpartum. And that's all done virtually. It starts January 5th. Your next cohort begins. So they can log in anywhere in the world and learn those 3 major support skills in the 3 months.
Absolutely.
Oh my gosh. So can you share a little bit about the birth process? So let's say somebody listening doesn't have the capacity or even desire to go and become a doula. Can we, as acupuncturists, still support the birth process? Like, how can we be there? What can we do to help a woman that's in labor and at the hospital even?
That's a great question. I do treat patients in labor as I give a choice to be their doula, where I would be on call and then be there for their entire labor, birth, and delivery, or to be an acudoula, where I would, or just like their acupuncturist. So I am an acudoula. So if I'm hired to do doula work, I would be doing acupuncture or acupressure. But then I can also just be their acupuncturist and come to their house, the birth center, sometimes the hospital. It depends now with COVID, but you can do many things. And I teach my pregnant patients that, like, if, for example, your bag of water breaks and you don't go into labor, call me. I'll come over. I'll do a home visit. No problem. We'll get it going, because they're trying to avoid induction a lot of times, or, they just want it to happen on their own, organically, naturally. Some people call me because of pain. They're really wanting a natural birth and their back hurts so bad they weren't expecting it. So I come in and I'm treating them for pain. Sometimes it's nausea. I've had women vomit all through their labor till I got there, and they stop. So that's very helpful. And anxiety. They're so stressed out. Think of all the things you could do. And, knowing, like, it's not like a regular acupuncture treatment when they're in labor. You're not going to like pin them down and be like, hey, just rest there for 20 minutes. No, that's not how it works. And so, knowing like you're going to be doing more acupressure, or if you put one point in with the next contraction, it's out and you're moving and walking and changing positions. So it's really fun and it's really helpful. Doulas really increase satisfaction with their birth experience, their bonding with the baby and their partner. And so being an acupuncturist and just helping them their labor progress, even to avoid interventions. All of this is so important to me because of the way of birth in the United States currently. If you look at the C-section rates, for example, I was born in the 1970s. The US had 7 to 12% C-section rate, which is awesome. It's a normal, healthy surgery saving lives. World Health Organization says 10 to 15%. Beautiful if you're in that range. The United States is currently 33, 34% C-section rate. So it's really a problem. And I'm hearing these women, like as the woman myself and as someone who's given birth myself, I hear these women come back to me and they cry and they tell me their story of labor and delivery and horror and birth trauma. And then it really affects them not having another baby or their infertility because their heart and their kidneys are not communicated because they're completely disassociated. I could go on and on,
Yeah.
So it's really important. The United States has the highest maternal mortality rate in all developed countries. Something is wrong despite all of our beautiful technology and developments. We need humanization, and acupuncture is a, one-on-one touching, feeling, healing medicine. And it's just paramount that we know that it's not only safe to treat, that it really will help them. And I'd like
Yeah.
to see the evolution of the evidence and the research and, moving forward in my lifetime. I hope to see really to see acupuncturists in hospitals. I was lucky enough to do an internship in a hospital at NYU with Claudia Sikovitz years ago. She no longer offers it, but it was beautiful to see that kind of thing working every single patient it worked for every single time. And we didn't use one needle the whole time I was there. So just amazing.
It's powerful. I mean, I absolutely love it. And I work with a lot of practitioners that are at a crossroads or want to pivot in their practice. And many of them might not even know that this is a possibility to pivot their practice towards everything to do with motherhood, right? Pregnancy, fertility, postpartum, and delivery. If that's your niche or your specialty, if you're drawn to that, this could be your practice. And like you said, we can make such a difference in the entire process. And if the delivery is a better delivery story, it matches more with what the birth story was written before delivery, it helps just like exponentially down the line with that entire family unit. The mother might have another child. I just love that you are waking people up, especially acupuncturists, to the fact that we can have such a profound effect with this entire process, the birth process, not just fertility. And then postpartum, I imagine you get really involved there as well, because what are some of the major things that you help women with in postpartum, overcoming?
Postpartum is mostly pain and mood. Postpartum depression is really a real thing. And to help support them with that, breast issues, mastitis is something I help hugely. And so as a doula, I'm there when the birth is happening. So they're usually naked and, it's okay. So over the years, women have come to me and said, help me. I feel like I'm getting a mass or something's happening. I'm getting an infection. So I self-taught myself breast cupping, and I will do that on women. And I actually wrote and published an article on it because it works. And if you're comfortable in that situation and the woman's comfortable with you, and, she can put her own oil on, but you can actually cup the site and then slide to the nipple and it comes out. And then she doesn't need antibiotics or go to the hospital. And there's just so many things like that we can do so easily with the tools we have at our hands as acupuncturists. I think it's just time that we all know this. It's not so, it doesn't have to be so difficult. And when you look at it, you could really help a lot of mamas and make a big difference in the world.
Yeah, dear to my heart as well. I've had 2 children, and so this topic is very dear to my heart as well, having gone through that process. And just recognizing how we can naturally help this process without the need of antibiotics and so forth. So just to let everybody know how to find you. I know you're doing the one in November. So just in a couple weeks, you're going to be, actually like a week, you're going to be in the East Coast, the Eastern School of Acupuncture and Traditional Medicine. You can go to their website, look at their CEUs. There may be space for that. January 5th, anybody can go to your website, which will be in the show notes, but it's www.pushprofessionalsmentorship.com, and you can see and learn more about that 3-month program, which starts in January. I imagine you're going to continue to do these the certification was what I was leading to, but I know you're going to be doing more classes, workshops, programs, and to that, the cat's out of the bag, you're working on actually creating a certification program similar to like SMAC or ABORM or some of our cosmetic ones that are out there. Because like you said, like you recognize what an opportunity to serve this population, and why not take all the knowledge that you've gathered over the last couple of decades, put them together, and then teach other people to serve their communities and their patients and so forth. So I'm thrilled. I love it. That's why we're on this call. I want more people to know about it. I want more people to engage with you. I want more people to think about this. I know myself personally, I have this little postcard, and my practice, which was in Del Mar, California, this was my card. I didn't have a business card. My card was all about moms, fertility, pregnancy support, postpartum awesomeness, right? I hold a space for moms and moms to be, and I was all in on that, right? I had a little picture of myself holding a baby. If you don't have a baby, just put a picture of a baby. The idea is so many people don't even know that we can help with that. And if you are going to pivot your practice towards fertility and pregnancy and birth and postpartum, that's what you lead with out there in the world. If somebody says, what do you do? Instead of saying, I'm an acupuncturist, you say, I help women deliver amazing, beautiful babies that are as closely aligned, if not better, to their birth story. And I help them live their best life postpartum wise, right? Not only just get back to how they were, they get even better than how they were because they're under my care. And that is my dream, that I think is very much tethered to your dream, to just get more of us out there to support these moms and help them. You know, I heard a comedian literally 2 days ago. I was listening to this comedian. I don't know her name, but she was in a pink suit. And she's like, postpartum depression, what are they talking about? If you're not depressed after you have a baby, there's something wrong with you. Like, I thought it was pretty funny, you know, because we all go through society thinking like, oh, every mom is just like bubbly and happy after they have a baby. No, not always, because many of them are sitting on a 2x4 ice pack with like, you know, hemorrhaging, and they're just like exhausted and they don't know what just happened to them. And we can help. We can help.
It's true. I always say it's not just about getting pregnant, but it's about staying pregnant, carrying to term, having a healthy baby and a healthy mom after giving birth. Yeah. So it's going through that whole process. And
an awesome experience of birthing.
Yes, because it can be so different than what it is.
It can, and I would probably even propose that it is always different. I remember when I was giving birth to my first child, I'm walking the halls just barely in labor, and all these women are screaming from their rooms. And I'm like, I will never be that kind of mom. Okay, fast forward 12 hours, and I am exactly that kind of mom. I'm screaming.
Yeah, it's work. It's called labor for a reason. It's a lot of work.
It is a lot of work. Honey, I love you. I am so grateful for you. And if anybody wants to connect with you, go to www.pushprofessionalsmentorship.com. Look up Deb Davies. She's on Facebook, on all the social media platforms. Go see her at the Eastern School of Acupuncture and Traditional Medicine. And then also in March, you're going to be speaking at Yosan.
At Yosan in Los Angeles.
This girl is out and about. She's a mover and shaker. Get her now before she's super famous, and get the training done. And we'll see you out there helping all the many people and having such an impact on the world. Thank you so much, Deb.
Oh, thank you, East. I really appreciate it.
Okay. Bye for now.
Bye.